Hey guys, so you're about to watch me debate Peyton, aka P Vanny. Now, this is happening because we have some back and forth on TikTok. We called each other some names, so on and so forth. I challenged him to a debate. Now, this guy is constantly trying to demean me. I don't really care. I don't care about his opinion, but he's saying I'm surface level, not intelligent, so on and so forth. But I mean, I say right back at him. He's an entertainer. He's not an intellectual. He doesn't know about any of the topics he's actually covering. And unfortunately for him, he decided to Twitch stream all of his research for the debate. He leaked his entire debate document. And I watched several hours of his Twitch stream of him researching for this debate. So I was able to anticipate almost every single argument he's bringing up. And it's really funny because he also did these mock debates and all this stuff like that, where he had his friends pretend to be me, and they clearly don't understand what type of arguments I would be bringing. So he did not prepare properly at all. They also said that he did double the amount of preparation, but I compared our two debate documents, and mine is literally double the size of his. So I think it's the opposite. But, anyways, I'm sorry that you have to watch a massacre like this, but let's get into it. So, of course, we're going to be debating on the efficacy of gender transitioning for minors specifically. We might touch up on it for adults as well, but really the focus here is minors. That's what the real debate is. So I'm Prax Benjamin. I'm a Henry Hazlitt Fellow with the Foundation for Economic Education. I do full-time writing, researching, making content, and so on. And yeah, all of my social media is just Prax Ben. You can find me all over. You can find my essays online. And yeah, Peyton, you can go ahead and introduce yourself.
Yeah, my name is Peyton, P. Vanny on all socials, and I will be arguing for the efficacy of transitioning for children, for minors.
All right, so we talked about opening statements. We
Mhm.
agreed that I would do the first opening statement, then Peyton will do his. I'm going to time these. We're going to try to keep them under 10 minutes. Should be relatively easy, but just in case, we'll keep an eye on the timer over here. And then we'll just go to open discussion. We might talk for 40 minutes or so. We'll just see how the conversation goes. Maybe it'll be a lot shorter, maybe it'll be a little longer. And then we might try to have closing statements. These, of course, won't be prepared unless you are able to write yours during the debate. That's
Okay,
fine. You don't have to have one. And then we'll just end the debate.
fantastic.
All right. So I'll start with my opening statement. In 2023, in the Journal of Sex and Marital Therapy, sorry, let me start that over. A 2003 paper in the Journal of Sex and Marital Therapy reads, the burden of proof demonstrating that a treatment does more good than harm is on those promoting the intervention, not those concerned about the harms. Until gender medicine commits to conducting high quality research capable of reliably demonstrating the preponderance of benefits over harms of these invasive interventions, we must be skeptical of the enthusiasm generated by headlines claiming that yet another gender study proved the benefits of transitioning youth. End of quote. I can't start off this debate without acknowledging the history that led us here. I've made a few videos responding to Peyton on the topics of reparations and transgender youth. The importance of this history is evident when you realize most of our discussion will be concerning the empirical evidence on this issue. Our previous encounters were also filled with empirical references and critiques. I specifically want to draw attention to two instances of Peyton offering critiques of studies that went against his position. In a video posted October 23rd, Peyton responds to a National Bureau of Economic Research paper, which I cited as evidence against his position. Peyton dismissed the paper for a few reasons, one of them being a supposed small sample size. What was the sample of this paper? It was more than 10,000 families. Now, I could say I can dismiss all of Peyton's studies if they have sample sizes of 10,000 or less, but that would be a little petty and bad faith. So we're not going to do that. I'll grant that this was an unrelated topic, or maybe he misread the paper or something like that. But in another video completely related to this topic, published on September 28th, Peyton cited and seemingly agreed with criticisms of a famous paper by Lisa Littman. The criticisms were that the sample size was too small, and she used a convenience sample, which possibly led to bias. I'll explain what a convenience sample is later. But as a 2020 paper in the Archives of Sexual Behavior points out, quote, the use of methodologies in Littman 2018 was consistent with those used elsewhere in the gender dysphoria research literature. Now, I'm not saying Littman's study is great empirical evidence, far from it, but this observation is entirely correct. The study's issues are very common in the literature on this subject. So since Peyton agrees with these criticisms, I expect him to, one, not cite studies that use small samples. Littman's was a little over 250, and two, not cite studies that use convenient samples. Again, we'll discuss that later. This will be quite the challenge for him because, again, the evidence on this topic is extraordinarily weak, far weaker than Peyton might think. This is especially true for the evidence on minors, but even the evidence on adult transitions is very, very shoddy. A few meta-analyses point this out. For example, hormonal therapy and sex reassignment, a systemic review and meta-analysis of quality of life and psychosocial outcomes, 2019. The evidence in this review is of this is a quote, the evidence in this review is of very low quality due to the serious methodological limitations of included studies. Here's another. Quality of life of treatment-seeking transgender adults, a systematic review and meta-analysis, 2018. Quote, the majority of studies were cross-sectional, lacked controls, and displayed moderate risk of bias, end of quote. And a third one, gender dysphoria and gender reassignment surgery by Jensen et al., 2016. Quote, overall, the quality and strength of evidence were low due to mostly observational study designs with no comparison groups, subjective endpoints, potential confounding, small sample sizes, lack of validated assessment tools, and considerable loss to follow-up. And as I said, no longer quoting, this is especially weak for children, despite what the advocates say. One such advocate is Dr. Jack Turbin, who has been described by Dr. Lior Sapir, who specializes on issues of gender identity and transgenderism, as, quote, less than honest, end of quote, due to the way he misrepresents studies and lies about the scientific consensus. Turbin likes to say, all experts agree with the gender-affirming model, a statement that is only true if you define expert in a no true Scotsman-like fashion, as only someone who agrees with Turbin or agrees with this ideology. An honest review of the data reveals something else entirely different, and that's the topic today. This evidence is so weak, in fact, that major institutions in countries like the UK, Finland, France, Sweden, Norway, and more are acknowledging this and backing off from these types of procedures. According to a National Institute for Health and Care Excellence review of evidence for puberty blockers, the studies are, quote, all small, uncontrolled observational studies, which are subject to bias and confounding and are of very low certainty, end of quote. A 2023 paper in the prestigious British Medical Journal points out, quote, there's little dispute within the medical community that children in distress need care, but concerns about the rapid, widespread adoption of interventions and calls for rigorous scientific review are coming from across the ideological spectrum, end of quote. Sweden's National Board of Health and Welfare, which sets guidelines for care, determined last year that the risk of puberty blockers and treatments with hormones, quote, currently outweigh the possible benefits for minors. So Peyton, just like Turbin, might try to argue that the American Medical Association, the American Academy of Pediatrics, the American Psychiatric Association, the American College of Physicians agree with him. But that's besides the point. We're talking about evidence here, not appeals to authority. But let's look at what evidence these institutions give us. So Turbin actually gives us all the documents from these institutions. So let's take a look at them. The American Medical Association, the document is called Health Insurance Coverage for Gender-Affirming Care for Transgender Patients. Again, this is what Turbin cites. A key claim made in it is, quote, recent research demonstrates that integrated affirmative models for care for use, which include access to medications and surgeries, result in fewer medical health concerns than has historically been seen among transgender populations. They then give a few footnotes that point to 3 studies: Leeper 2012, Maniville 2012, and Hill 2010. But none of these 3 studies have any outcome data at all. So it's very bad form for the AMA to claim X and then point to not 1, but 3 studies that offer no statistical evidence in support of X. The American Academy of Pediatrics document is ensuring comprehensive care and support for transgender, diverse children and adolescents. So in this statement, they have a little rundown of these issues. Let's see, it has the claim There is a limited but growing body of evidence that suggests that using an integrated affirmative model results in young people having fewer mental health concerns, whether they ultimately identify as transgender. End of quote. And then 3 citations are given. Oh, oops, they're the exact same 3 citations in the same order. Someone was lazy. All right, let's continue. The American Psychiatric Association citation points to 2 documents. The first is a guide for working with transgender and gender nonconforming parents. This document has nothing to do with the debate at hand. There's no mention of youth treatment anywhere or the efficacy of it. The medical treatment and surgical intervention section in the document deals entirely with adults, doesn't even talk about puberty blockers. Okay, but they have a second document, a position statement on treatment of transgender and gender diverse youth. This one includes the statement, quote, trans affirming treatment such as the use of puberty suppression is associated with the relief of emotional distress and notable gains in psychosocial and emotional development in trans and gender diverse youth. There's no citation. Okay, no evidence. All right. Finally, the American Academy of Child and Adolescent Psychiatry, quote, research consistently demonstrates that gender diverse youth who are supported to live and or explore the gender role that is consistent with their gender identity have better mental health outcomes than those who are not, end of quote. They give 3 citations. The first is a study that can't provide any information on the question because there's no comparison with a group of less supported kids. The second study found no statistically significant links among trans kids between family support and positive outcomes on 6 of 7 measures. Large majority. Probably because there was a tiny sample of 22. Only 22 people in that second study. The third study didn't really show a link between family acceptance and well-being among the tiny group of trans kids studied. So the evidence to support medically transitioning minors is not there. None of them cite it. Not only that, but what little evidence we do have shows absolutely no, what little good evidence we do have, I should say, shows absolutely no improvements for children who undergo these treatments. Example, Diane Tordoff's 2022 study in JAMA, Kaltiala's 2019 study in the Nordic Journal of Psychiatry, and some even show things getting worse for the patients, such as a 2021 study in the Journal of Medicine, of Sexual Medicine, showing a 70% increase in suicidality after gender affirming care. My conclusion is very simple. Let kids turn 18 before they make the decision to transition. Kids do not have the mental capacity to understand how bad this evidence is. They have less reasoning capacity. Kids are flippant. They follow the crowd. This seems to be backed up by the evidence, since as Dr. James Cantor, a sexual behavior scientist, points out, quote, the exact number varies by study, but roughly 60 to 90% of trans kids turn out to no longer be trans by adulthood, end of quote. If this so-called evidence were used to justify any other treatment at all, especially for children, we would never let them go through with it. And that's the end.
Done?
Yep.
Fantastic. Can I debunk that last claim first, or do you want me to start with my opening statements?
Nope, a opening statement.
Fantastic. I would first like to bring up something that you've said, you believe, which is that the burden of proof is on people like myself who want these medical treatments to be available. Again, I would counter. It's the exact opposite. Summing up why, with the statements of Dr. Jack Turban, assistant professor of child and adolescent psychiatry at UCSF, while in court summary opposing an Oklahoma bill that attempted to make it a felony for medical professionals to give transgender youths gender-affirming medical care. Quote, gender-affirming medical interventions greatly improve the mental health outcomes for adolescents with gender dysphoria and detransition and regret among those who receive medical treatments are uncommon, and the banning of access to such medical care runs counter to the widely accepted views of the mainstream medical community. Dr. Turban has been published somewhere between 20 and 30 times in peer-reviewed journals regarding mental health of transgender youth and adolescents with gender dysphoria, with 0 retractions and numerous national accolades to boot. So again, some would call him an expert on this topic. But let's hone in on that last part specifically, the banning of medical procedures running counter to the widely accepted views of the mainstream medical community. What do I mean by that? Places like again, trying to discredit these places really holds no weight. The American Medical Association, the American Academy of Pediatrics, the American Psychiatric Association, the American College of Physicians, the Endocrine Society, again, I could go on, have all highlighted the importance of this care and have issued explicit statements opposing bans on gender-affirming medical care for adolescents with gender dysphoria. And the reason they all agree on opposing these bans is backed up by decades and decades of research in the field supporting the efficacy of these practices. So you saying the burden of proof lies on these organizations is illogical. The burden lies on the people attempting to ban these procedures that have been going on for decades to provide the amount of research, facts, and data it takes to prove these organizations, doctors, scientists, wrong. But by the time you would have done that, they would have already done it themselves. These are medical professionals. They only have one goal: the medical and safety and well-being of the public. Secondly, we know about hormones and puberty blockers, which we will be discussing, but I also need to establish what we're referring to when we're talking about medical surgeries performed on trans youths, so we can both move forward with the same guidelines. Is that fair? Fantastic. By the rules set forth by the Endocrine Society Clinical Practice Guidelines and the World Professional Association for Transgender Health, genital surgery or removal of the gonads is not performed until the individual is of 18. Nothing below the belt is happening whatsoever to children in any case unless it is medically necessary. That is the rule set forth. Any exceptions to the rule would be considered medically necessary within whatever subsets they would be. However, individuals younger than 18 may be eligible for chest and breast surgery or top surgery when they meet the following criteria: persistent, well-documented gender dysphoria. You cannot just walk in, say that you feel a certain way, and start having surgeries done. The capacity to make a fully informed decision and to consent for treatment. Age of majority in a given country or parents' consent. And if significant medical or mental health concerns are present, they must be reasonably well controlled. And it should be noted for the record, when studies have been done comparing the surgery success rates and satisfaction of top surgery between those older and younger than 18, such as the Wolf study published in 2022, the data showed those younger than 18 experienced fewer complications and revision procedures while having higher satisfaction rates with the surgical outcome. Meaning, the younger these surgeries are happening, which is no younger than 16 in 99% of the cases, and 18 or over in the majority, the better the surgeries go and the happier these individuals are. But again, we're getting ahead of ourselves. Let's talk about the life of a child with gender dysphoria to paint a picture, beginning with the guidelines for diagnosing a child with gender dysphoria. The child needs to have been consistently expressing ideas of them not feeling like the sex they were assigned at birth. No, this does not include playing with certain toys, doing certain activities, dressing a certain way. Those do not meet the criteria of being diagnosed. But at the point where they have been constantly expressing those ideas, their healthcare provider would recommend different therapists or psychologists for them to speak to for an extended period of time, which is no less than 6 months, typically longer. 6 months of feeling this way and repeatedly showing this to a licensed medical professional before even being diagnosed with gender dysphoria. There's a common misconception that kids can say, I feel like a girl, and then decide to walk into a clinic and get some sort of puberty blocker, get started. I'm diagnosed. I have gender dysphoria. It's not how it works. This is a heavily structured field that takes careful consideration into every single child with any of these specific ideas. So 6 months of feeling this way, at least, and repeatedly showing this to a licensed medical professional before even being diagnosed with gender dysphoria. And that's when social transitioning begins. Nothing medical at all, just doing things to express yourself socially as the gender you feel. And it is only after the child hits puberty and begins asking for and expressing the need to take further steps in transitioning for the sake of their mental health that the professionals that they have been re-diagnosing, or that who have been re-diagnosing them and speaking with the child, will inform the parents and the child of completely safe means to continue furthering their gender expression. We can get into the specific criteria that needs to be met later. Opening statements for now. These include things like hormone therapy and puberty blockers, which begin to have the child's body reflect the way they have felt on the inside and have been proven for decades to improve the child's mental health over the coming years. But since I know you love your studies, Ben, in regards to the effectiveness of puberty blockers and hormone therapy, the majority of peer-reviewed cross-sectional and longitudinal studies have found that puberty suppression is associated with a range of improved mental health outcomes for adolescents with gender dysphoria, including statistically significant improvements in internalizing psychopathology, externalizing psychopathology, global functioning, and suicidality. If you would like a specific example, I could cite a 2020 study published in the Journal of Adolescent Health, which compared 272 adolescents who had not yet received pubertal suppression with 178 adolescents who had been treated with pubertal suppression. And those who had received pubertal suppression had statistically significantly lower internalizing psychopathology scores, and longitudinal studies have yielded similar results. And it's the exact same case for hormone therapy. The majority of peer-reviewed cross-sectional and longitudinal studies have found improved mental health outcomes for gender-affirming hormone treatment for individuals with gender dysphoria, including adolescents. These include statistically significant improvements in internalizing psychopathology, general well-being, and suicidality. And if you'd like an example of this, a study published in 2023, this year, in the New England Journal of Medicine, followed a cohort of 315 transgender youth for 2 years after receiving gender-affirming hormone treatment and found overwhelming improvements in anxiety, depression, and life satisfaction. Now, trust and believe, I have as many as you would like. I can send them to you after this, but right now I'd like to keep moving. And just in case this gets brought up, which I think you tried to, as it gets brought up a lot when we're talking about the validity of studies pertaining to this topic, given the methodological limitations of randomized controlled trials, complementary and well-designed observational studies offer more reliable scientific evidence than RCTs, and they have been considered of sufficient quality to guide clinical practices and policymaking for decades upon decades. Just because you know a lot about one specific type of study does not mean you know how these worlds work. I will continue. Also, you have been quick to point out flaws in systematic literature reviews I have used in the past, looking at specific studies within them and criticizing those. So before we continue, do you know how these studies work? I'm not trying to play to your intelligence. I am genuinely asking just so we can continue. Okay. So
am I on? Your alarm just went off. That's 10 minutes. Do you want to finish up real quick?
Yep.
Go ahead.
There's no way it's been 10 minutes.
No, it's 10 minutes. Yeah, you can finish up like your last statement. It's okay.
Thanks, man. Do you know how systematic literature reviews work?
Yeah.
Okay, fantastic. Just in case your audience or my audience doesn't. Systematic literature reviews, in simple terms, are taking a multitude of different studies pertaining to a topic, looking at the results within them all, and getting an overall consensus on the topic from the specific results. It's kind of like a scatter plot, but the line going through it is the overall conclusions we can derive from these studies. So while one study within the group could have a factor weaker than another, the point is the other studies make up for that. So again, for you and your audience, just because one study within the aggregate might be weaker than the others, that does not mean it disregards the entire aggregate. That is antithetical to how these literature reviews work. I only bring this up because when it comes to the topic we are discussing, these reviews are critical to providing the data the medical community goes off of, into understanding the topic on a wider scale. And having said that, another study you've tried to represent as less of a massive data point than it is, albeit poorly, is the Tordoff study, published in 2022, which looked at 104 transgender youths over the course of a year, 69 of which by the end of the study were on puberty blockers, hormone therapy, etc., or both, and 39 of which who were not. After adjustment for temporal trends and potential confounders, they observed 60% lower odds of depression and 73% lower odds of suicidality among the youths who had initiated puberty blockers or gender-affirming hormones compared with the youths who had not. Those are facts. That is what this study showed us, which is a massive difference. And the points you have brought up to debunk it in the past are completely fine for you and a subsect of people to have. But seeing as you and this subsect of people hold no bearing on what the medical community deems as conclusive, you hold no weight when actually assessing the data from this study. And the people who have conducted the study as well, if you would have looked into it, as well as their peers, have reviewed it and after the fact pointed out in the past that you are wrong in your worries about the validity of it. So, to summarize, with everything out of the way, according to the practices of all American medical associations, and according to the majority of medical and scientific research, gender-affirming medical care for transgender youths is vital and the safest way to ensure these children diagnosed with gender dysphoria grow into adults and live a long, happy life. Now that my opening's done, the opening discussion has begun. I would like to get the ball rolling by asking you, since you oppose life-saving, gender-affirming care for minors, how do you think gender dysphoria should be treated when it pertains to children? And what unbiased scientific facts do you have to back that up? Or if you'd prefer to ask me questions on issues, you may.
Yeah, I have one question, and then I want to get into talking about some of the opening statements, but I'll answer your question first. So, number one, first, provide them with adequate psychological care surrounding other mental health concerns.
They already do.
As several experts on the matter agree in a 2021 paper in the Archives of Sexual Behavior, we believe that exploratory psychotherapy that is neither affirmation nor conversion should be the first line of treatment for all young people with gender dysphoria,
Absolutely.
potentially
They already
reducing
take
the
that
need
into
for
account.
invasive and irreversible medical procedures.
Which
This is
again, we've
especially
discussed
critical.
are not.
I'm answering your question.
I will not let you spout transphobic
This
rhetoric.
is especially critical now when we are witnessing
We
an
have
exponential
already
rise
described
in the
them,
incidence.
and we know that they are
You can't ask
reversible.
me questions and then interrupt my answer. That's
I
an
will not let you
absurd
spout
debate
transphobic
etiquette.
rhetoric.
That's an absurd debate etiquette.
I'm not going to let you spout transphobic rhetoric.
I'm reading from a peer-reviewed paper. You asked
Absolutely.
me. Okay,
A
okay. I'm
biased
not going to answer your
peer-reviewed
question.
paper.
All right, no answering your question. We'll never know
Okay,
what
go
my
into it
opinion
then.
on that is. Okay,
Go
sure.
into it
So
then.
I have an answer. I have a question for you. So that
Yes.
question is, if the AMA and the APA and all of these institutions came out tomorrow and said, we have groundbreaking new research, transgender people aren't real. Being trans isn't real. Would you agree with them?
Yes.
You would agree with them? You would say transgender people aren't real?
Yes.
Okay, fair enough. All right.
I would
Now-
still respect the people who are transgender in my life and transgender in my following.
Okay.
I would absolutely respect whatever they did to come to that conclusion. However, it's speculative and a what if because it would never happen that way. But
Oh, I'm
I like
sure.
your line of questioning being incredibly vague. Yeah.
Okay. So one of the first studies you brought up was Van der Meesen, the 2020
Yep.
paper. Now, it's very evident that you didn't actually read this paper because this is a quote
did.
by the authors in the no, you didn't. The present study can therefore not provide evidence about the direct benefits of puberty suppression over time and long-term mental health outcomes. But that's exactly what you did. You did exactly what the authors said not to do. So I'm curious why, if you did read it, why did you think they were wrong?
I explained to you exactly what that study was.
Yeah, you
I
did.
did
and I
not
already
give
knew what
any
it was.
implications as to the overall.
You did. You
I
said
did not.
You said the overwhelming amount of evidence supports the idea that this is better, makes things better for children, right? So the implication was exactly what the author said is not the case in the paper.
Implication is different than actually stating what it is.
Okay, so you can see
Again,
that
you've
that's not the
fallen into
case.
that in the past.
So you can see that that's not the case then. You can see that this paper is not evidence for your position, right?
Okay, am I allowed to scrutinize you now?
Sure.
Fantastic. So
That
you
was a
bring up,
concession, by the way. That was a concession. So that's first
yeah,
concession.
I
One.
help your ego. So debunking the myth of trans dissonance, right?
Okay.
You brought up 70 to 90%. When they get to adulthood, they end up not being trans, right?
About 69% is what the evidence shows. No.
Not what you said. You said 80, but let's
No,
continue.
I said,
Actually, I believe
sorry,
you said
60
90.
to 80%.
Yeah. Okay. So what you're quoting is a study by Dr. Kay Zucker, who,
No, I was quoting Dr. James Cantor.
oh, fantastic. That's actually even worse. I'm not going to lie.
Is it? Why?
That's so great. Yes.
Why?
Because Dr. James Cantor was a known horrible person and cited a lot of her research in what they were talking about.
Mm-hmm.
Dr. Kay Zucker, formerly of Toronto CAMH Clinic, has also claimed that gender dysphoria desisted in 80% of cases. However, when the patient files at the clinic were reviewed by independent investigators, they found 42% never even met the clinical criteria for juvenile gender dysphoria. And they also found out that not only did it not support her hypotheses, it ended up being in favor of children turning into adults eventually, or transgender children turning into transgender adults eventually. As a result, the 84% of desistant figures is meaningless because you have no idea how many of the kids ended up transitioning and no idea how many of them were actually gender dysphoric to begin with. When Dr. Steensma went back in 2013,
Zucker, though. You're not talking about anything that I cited.
Pause. All of the research that is done on dissonance all eventually stemmed from this. I've looked up the paper you're talking about. I know exactly the paper you're talking about. Absolutely. If you are willing to claim
before Zucker's study, what are you talking about? The Zucker
study
was in 2008. The first study on this was in 1972.
I just said she cited it in her shit. What the fuck are you talking about?
You said all of the research on this topic comes from Zucker's study, but it doesn't.
I meant to flip flop, but I apologize. Anyway.
I never cited Zucker, so I don't know why you're bringing up Zucker. I have 10 studies about this that aren't Zucker from James Cantor.
Again, James Cantor. 1 second. Because I'm actually kind of a little upset that it's gone from my paper, but it's fine. Here we go. James Cantor, pedophilia and the gender critical movement. James Cantor is a prominent defender of Blanchard's trans, misogynistic, and widely discredited typology of transsexuals.
Wait, what are you reading from?
The Medium.
The Medium is a site where you post blogs.
Uh-huh.
Literally anybody can publish on Medium. What do you mean the Medium?
Which has... Hold on.
Okay.
Will you let me finish?
This is absurd. You just Googled something like James Cantor debunked, and then it's like, oh, hold on, let me hurry up and come on. This is not how you do debate.
Well, that's because that's exactly what I did to get to the research that I had here. That
yeah, I know it's. What
I don't know
did.
how it was deleted.
Hey, and I watched 8 hours of your Twitch stream. I watched 8 hours. I knew every single argument you were going to bring. I know every single point you were going to bring up. I know why you're wrong on every single point.
Which again holds no basis.
Debunked. X study debunked. I watched how biased your research is. You sat here and you told everyone, Ben is so biased. You go look up online, X debunked. You looked up papers that debunked yourself and looked at them.
Ben, stop getting emotional.
The evidence.
Ben,
that's what you did.
Stop getting emotional.
I have screenshots of it.
Ben,
stop getting emotional.
Stop getting emotional.
You, dude. I actually have some screenshots I can show on screen for everybody. You want to see them?
Stop getting emotional. If we can stay on topic.
It's on topic of you Googling during the debate, James Cantor debunked because I said James
What were you,
Cantor?
hold on, pause.
What
were you, pause. What were you just Googling when I was talking?
No, I was not Googling. I was looking at my debate document. I haven't Googled at all.
Let's continue on topic.
Okay. Maybe don't Google stuff and read out blogs that you've never read, okay? That's all I'm asking.
I have read them.
No, you haven't.
I've read everything on James Cantor.
Actually, okay.
that I was
let's-
going to bring up today?
So let me bring up a specific. Let me tell people how you don't read your sources, because I have a bunch of examples. I have it recorded. All right,
Mm-hmm.
guys. You know how we brought up how randomized controlled trials are methodologically weak? He was reading almost verbatim from a paper that he found just Googling real quick. He didn't read the paper. He went to the conclusions. He copy pasted it into his document, added a couple more words to it. He doesn't even know why they're methodologically weak. He can explain it to you.
Ben?
Watch. Hayden, explain why they're weak. Go ahead.
Excuse me?
Exactly. You are a fraud. You are an entertainer. You are not a debater. You are not an intellectual. I watched you be an absolute dumbass for 8 hours straight. You are a dumbass. This is embarrassing for you. Okay, I have screenshots of you Googling.
Again,
study
Ben,
study debate.
Ben,
You want me to show you guys? What?
Again, Ben, if you'd like to stay on topic and actually debate, because you're the
This is so
intellectual
good.
here, right?
Absolutely, yeah.
Then can we stay on topic and debate?
Could you answer the question? Could you explain why their method? Are you going to admit that you plagiarized that paper and didn't actually read it?
Plagiarize what
opening
exactly?
statement? You plagiarized Diane Portof's paper on randomized control trials. You pulled. I have a
plagiarize
video
it.
of it. I screen recorded it.
Can you let me talk?
Yeah, go ahead.
I didn't plagiarize it, citing sources from
You
medical
never cited it
researchers.
though. You didn't cite it though. You just read it. You didn't cite it. You didn't say, oh, from this paper they say this. You
We're
plagiarized.
not in college, right?
Oh, we're not in college, so plagiarizing is okay. All right.
Again,
all right.
we're not in
yeah,
college. There are
yeah.
no precedents for what you're considering plagiarism in this.
But why didn't you read
This
the
is a
paper?
widely accepted
Why didn't you read it?
consensus.
I have a video of you copy and pasting it. You didn't read it. I
Read
can
it.
post it on my TikTok later. Everybody
Read it
can watch
where?
it.
Out loud?
No, you didn't read it at all. You Googled something real quick. You saw this article, you clicked on it, you scrolled down to the conclusion, and then you copy and pasted that section. Again, you can't tell me why randomized control trials are methodologically weak. You can only read. You can only read what that said. Can you explain to us why they're weak and prove that you actually read it? Again, I have a video, so you can't lie here. I screen
Ben,
recorded it because I'm not a
Again, you're
fucking
getting
retard.
really emotional right now.
I'm
I'd
not
like you to
emotional.
stay
I'm
on topic.
ecstatic. This is hilarious. This is embarrassing for you, dude. Genuinely embarrassing.
I don't know how me trying to stay on topic and you flying off handle emotionally is embarrassing for me. But
The Lippmann study debunk. This is how he does research, guys. I have about 40 screenshots like this.
again,
Also, I would like to
these
talk
are
about
things
a
that
few
I
other
have
things.
already known that I need to be able to make in a concise fashion.
Okay, yeah, sure. It's always the excuses, like that study you cited, which didn't say what you said it said, and then you're like, well, actually, no, you're just reading into what I said too much. Okay, dude, you are absurdly stupid, like genuinely.
Again, Ben, throwing out these things is doing nothing for your argument.
I already made my argument, and I pointed out. Hey, let's talk about the Tordoff study. You completely misrepresented that one. That one didn't show at all that the conditions
Yes.
of the transgender kids who were on
Yes, it
puberty
does.
blockers improved. No, it doesn't.
Yes,
Want me
it
to pull up the data?
absolutely does.
All right, let's pull up the data.
Pulling up supplemental
Whoa,
data
don't
as
pull
if
up-
you are
don't
the
pull up the
factor,
data.
as if you are the god of this paper, again, holds
No,
no
no,
weight to how
what
it's
does that
actually
even
treated in the
mean?
medical community.
That's absurd. What are you talking about? I'm showing you what the author wrote. What do you mean? What does this mean? I don't know. That's crazy. Crazy.
Read the study then.
Let's pull up the data. I'm going to pull it up right now.
No, you said you were going to read what the author said. Read what the author said.
Yeah, I am. That's exactly what I'm doing. All right, here it is. Let's go. All right, as you can see right here, we're looking at E table 3. So this is the raw data, right?
Again,
So
looking at a
ED
specific table. Ben, I said, read what the author said.
Don't
I
look
did
at the
not
data.
say
Don't
look at the
data,
table.
guys. Don't look at the data.
Also, you're not on the study. You're on the publication.
This is the data from the study. Yeah. This is the data that Diane Tordoff published.
So you said you would read what the author said. Read
Yeah,
what the author
right
said
here.
for the group.
Right here. E-table prevalence of outcomes over time by exposure group. So you have the baseline, the 3-month follow-up, the 6-month follow-up, and the 12-month follow-up. The PBGAH That's puberty blockers,
Again,
gender affirming hormones,
Ben,
and then none.
you're getting really emotional about this. Read what the author
This
said.
manipulation doesn't work with me, Peyton. This doesn't work. Why do you think this?
I'm not trying to manipulate you. I'm asking you to stay on topic.
You're saying, oh, you're emotional. I'm giving you the facts, man. Giving you the
You're
facts.
not. You're misrepresenting the facts of this study to make yourself look better.
Explain how I'm misrepresenting it. Go ahead.
Again, not a doctor, right? Not a researcher.
Explain.
What we do is we focus on what researchers say.
This is such a cope. Explain how I'm misrepresenting. You can't explain any of this.
First of all, you've been debunked multiple times in the past on your methodology as it pertains to how you're reading these tables. So I'm not going to do that. People have already done it for me.
Do you know what a cross-sectional study is?
Yeah.
Do you know the definition of cross-sectional study?
Yeah.
What is it?
Things that span different groups.
Things that span different groups. Yeah, brilliant man right here. All right. I think I've proven like quite like this is going better than I thought. Like
you really haven't proven anything. You've proven that you're quick to emotion.
Research, how you do this terrible job at research. And keep in mind, I was not going to do this to you, right? I was going to take this very slow, but you right off the bat were being an absolute ass to me.
I was not.
This is what I'm doing. This is how I'm responding. You interrupted me when I was answering your question. So you were such an asshole to me.
I'm not going to entertain transphobic rhetoric.
Right off the bat.
Again, I'm not going to entertain transphobic rhetoric.
Okay.
Puberty blockers, hormone therapy have been shown to be incredibly reversible across the board.
That's not true. That's complete blatant lie.
No, it is not.
Yes, it is.
And also the idea that these kids are ill-informed on what they're taking is also completely false.
No, it's not.
They have to give medically informed consent. They have to be overly informed. I can go through the papers that you have to pay attention to before you even get with a parent.
Yeah, okay. So here's the problems caused by these things, all right? Problems in bone mass density accrual, puberty blockers, and cross-sex hormones. They compromise bone health. They prevent maturation of the brain, cause infertility, deteriorate genitalia, and triple the risk of cardiovascular disease. That's what the evidence shows, okay? Like, for example, like if a girl gets on testosterone treatment, it will actually deteriorate the flesh, her vaginal tissue. And if she has sex, she can bleed to death. It will destroy her vaginal canal and she can bleed to death.
Again, right? Every single drug.
Do you think a kid can grasp this, that she can bleed to death through her vagina? No, of course not. That's absurd.
They aren't allowed to begin these things without informed consent.
Again, secondly, do you think a kid can understand the implications
I think a parent
through her vagina?
I think not only a kid can, but a parent can as well. And you're using kid very loosely. They cannot begin these things until they've started to hit puberty.
Yeah. Oh, actually, a 12-year-old isn't a kid. Yeah. Okay.
They are kids, but saying it as if 4-year-olds are getting these surgeries that are going to ruin their life or taking these drugs that are going to ruin their life is incredibly misrepresentative of what actually happens.
Absolutely not. That's what the overwhelming evidence shows.
It doesn't, though, right?
You haven't,
because we know what the procedures are.
Evidence in support of your position at all. I've cited a ton in my opening statement.
Again,
I can keep citing it.
If you would like me to go through the steps it takes.
No, I don't care about
to begin even talking about puberty blockers.
There's only 40 steps instead of there's 40 steps instead of 30 steps for you to go through this.
Okay, Ben, explain to me drugs that people take right in the world that don't have side effects.
Drugs do have side effects.
Oh,
I'm not contesting that.
What about the effects of antidepressants on kids?
Yeah,
right.
They do have side effects.
Absolutely.
Yeah.
We
and what do we do?
Are not banning antidepressants for kids, correct?
What do we do before we put those antidepressants out for kids to get on them?
And it takes 2 weeks. Hold on. Are you trying to tell me that puberty blockers and hormone therapy haven't been tested on the public?
They have not
for an extended period of time.
We do not have the adequate evidence to say that this actually helps kids. Like I said,
we absolutely do.
Then cite it.
Puberty blockers have been used in kids with precocious puberty for decades and decades and decades.
Okay, so precocious puberty. I knew you would bring this up because again, I watched 8 hours of your stream. So what you're pointing out is
it's not in my evidence. So
whoa. What you're pointing out is look, there's a kid with a hormonal imbalance. Their hormones are off, and we do stuff to put it back to normal. So that's the same as a kid who has normal hormones and we put it way off. That's not the
Okay.
same, actually.
Then do me a favor, because you're the expert, right? Tell me what the percentage of issue with these drugs in kids is, and I'm more than happy to pick it with you and overturn this.
We don't know the percentage, right? So this is one of the
Interesting.
problems. This is
So then
one of
what
the
we
problems.
do,
The
hold
evidence
on.
is so
When
weak.
what
The
we
evidence
do,
is so weak.
what we do when
But
we
do
don't
know
know
that these
something
drugs
right.
cause problems.
Hold
We
on.
do know that.
What we know that all drugs cause problems. We've already contested
Severe
that, right?
problems to children.
Again, we know that most drugs that kids are put on to
Healthy
handle
children, by the
disorders
way.
such as this. Again, not going to support transphobic shit, but again, when we don't know anything, right? Who do we turn to? Our medical professionals. And across the board, medical professionals are against the banning of this medically
Do you have
necessary.
a source for that?
Yes. Go look at their websites if you'd like. Any of the ones that I've fucking
All the
stated.
websites that I quoted in my opening statement, pointing out that literally none of them cite any evidence.
Again, because you think that
And this is the
does not
only
make
a
it
handful
true.
of American institutions, by the way. Like I said in my opening statement, the UK, Sweden, Norway, Finland, all these countries, all their medical institutions are contradicting you. So
what you're failing to put into retrospective for the entirety of the audience right now is the uprise in anti-trans rhetoric in these countries that have stemmed from the US.
When medical institutions disagree with you, then they're bigots. If they agree
It's
with
not
you, then
medical
follow the
institutions,
medical institutions.
institutions that are disagreeing
That's
with
how
me.
it works every single time.
It's not medical institutions that are disagreeing
Yes,
with
it is.
me.
I
And
quoted the
other
medical
countries,
institutions in my opening statement.
and other countries in general, I could give a shred of a shit about. We're talking about America.
Of
We're talking
course, we
about
don't care about the
American
medical.
kids.
See what you don't realize. Well, you do realize this. There's a global medical community. It's not. I'm not a nationalist here. Okay. There's a global
Absolutely.
medical community, and so if a majority of the world is saying no, this is bad, and one country is saying this is good, why should I listen to the minority of the medical community?
Show me the facts that the rest of the world
I quoted them in my opening
agrees or
statement.
disagrees. No.
But
Show
a
me the
major
facts.
institution in Sweden specifically said there's no evidence that the
So a
benefits
major,
outweigh the harm.
so one major institution, not the country of Sweden, but continue.
I also cited the NISE. There's also the NHS. The NHS put out Dr. Hilary Cass to investigate all of this. She put out a report. She said there is, like when I mentioned brain maturation earlier, she pointed out there is problems that can be caused with brain maturation, meaning we're actually fucking with kids' brains and they don't develop properly, and they can have these permanent effects in their brains for the rest of their lives. That's something very serious, and we should not brush that away. I can send you the evidence. I have a peer review.
Again, a small percentage of things that have been shown have not overturned anything in the minds of the majority of medical
countries that practice this. Most of them overturned.
I am not talking about other countries. We are talking about America.
By state, overturning it in America, state by state. Look at the map of 2 years ago versus
it's not medical associations overturning it state by state. It's legislators overturning it state by state. You know damn well there is a complete difference between that.
Legislators who are having expert witnesses who are against your position come up, like
specific
Dr. James Cantor
experts that go against the entire aggregate.
It's not the entire aggregate. Again, like you have no evidence for this. You have no evidence. Do you have any surveys of the medical community that say this? No.
My evidence is this, Ben. They have yet to come out and say that this medically, in fact, they've been on the opposite end of this argument for what you think that they are. Therefore, we have no reason to speculate that these guys are just lying to us and there's things going on and there's an agenda.
They are. If they say that we have evidence that it helps kids, we don't. Again, you haven't given me any. You cited that one paper that disagreed with you.
Just because
you cited
you don't believe
that disagrees with you.
Again, Ben, just because you don't believe these things, I'm sorry, it doesn't make the rest of the world conform to it, right? It doesn't make actual medical professionals, actual scientists conform to it.
You can't you actually conceded with my criticism of that first study you cited, right? So, I mean, you agree with me.
citing one study. Okay.
And mind you, all this, I saw your entire document, you leaked it, and I have responses to every single
Gender
citation.
cognition in transgender children, Dr. Christina R. Olson, published in Psychology Science in 2015. This study investigated 32 transgender children who are living as their gender identity, 18 of their siblings, and 32 matched controls, gender typical children aged 5 to 12.
Including
The
this one.
researchers, say again?
I said including this one. I know
Mm.
I also saw you bring up
I
this
can't
one.
wait to hear how you debunk this, but the researchers administered the same set of tasks to all participants. Some tasks were the type you can easily control in terms of responses, like answering what gender you feel like inside. Others are harder to control based on things like reaction time to computerized tests, which psychologists believe helps clarify someone's attitudes and beliefs without their responses being potentially contaminated by desirable biases. The urge to please parents and so on, things like that. They found gender cognition in the transgender kids was indistinguishable from their peers and siblings, but in the direction of their gender identity, not their sex. For example, in the case of a child who was assigned male sex at birth, but now lives fully as a girl, her responses to all the studies, tasks, were indistinguishable from transgender girls. Across all these tasks, across the more and the less controllable measures of gender development, the transgender participants look like just the other kids, but in the direction of the gender identity rather than their assigned sex at birth.
Okay, how many kids were they looking at?
32.
32, right. So we're first of all, we're starting off with a number significantly lower, almost 10 times lower than what Peyton said, as I pointed out in my opening statement, is a too small sample size.
Again,
remember,
our
Littman
things
used
outside of the
256.
debate. Again, our things outside of the debate and you not understanding sample size as it correlates
Could you explain
to
sample
specific
size
studies. Okay, cool. Depending on the topic at hand, the results you're trying to find, sample size is incredibly important.
Mm-hmm.
For situations like this, a small sample size is completely fine and within the guidelines of these studies.
You're just yapping. You're just yapping. You didn't answer my question. You're just yapping.
The fuck are you talking about?
Restated your position with more words.
I
Why?
literally just gave you your
why?
question.
Why?
Because depending on what you are looking at.
So why is that small sample size okay in this study?
Because it's not because it is not looking at the implications of slavery on Black people, Ben. That's why.
I was referencing Littman's study. What are you talking?
No, you weren't. You were referencing. First of all, you referenced the reparations video earlier. What the fuck are you talking about?
No,
you've been all over the map with everything you've been saying.
I brought up that study, and then I said, but to be fair, that's a different topic. And then I said the criticisms you had of Littman's study, which was number one, a compliance sample. By the way, this study you're citing right now uses a compliance sample, and you said that causes bias.
I know.
Number two, the sample size was too small. It was 256. This one is 32. Was Littman's study right?
No.
Were you wrong?
Because there were on top of that a ton of other methodological.
You didn't mention
things
those
wrong with it.
Did you?
Say again?
You didn't mention those in your video. You only mentioned the two.
Ben, just because we have different types of content and things require different types.
Yeah, you're an entertainer. I'm an intellectual. I already established that.
Again, Ben, just because you go over a bunch of studies in your videos does not make you an intellectual, especially when most of the topics you're arguing makes you sound like a bit of a moron.
Oh no. By the way, the guy calling me a moron, I think it was last night. So they were trying to look into my past and like dox me or something. I don't know. But they saw that I did a short
for sure was not.
They saw I did a short like internship thing at the Ludwig von Mises Institute, which is named after an economist, a Jewish economist, Ludwig von Mises. They saw that on his Wikipedia page, it said that he fled from the Nazis, and they determined from this that he must have been a Nazi, and therefore I'm a Nazi. That's how absurdly
we never said that.
I have a screen recording of it.
I never said that he was a Nazi.
That was the implication.
We may have joked. We may have joked.
Oh, it was a joke.
But
yeah,
Ben, possibly, could
Yeah,
it
yeah.
possibly
It's
mean
always a joke.
if a lot of people tend to think that you are a bit of a Nazi sympathizer,
Also,
you could
when have I
possibly
ever
been one?
sympathized with Nazis? Could you name one time?
Jed, you want to throw those in the chat?
Could you name
Appreciate
one
it.
time?
Excuse me?
When have I ever sympathized with a Nazi?
Ben, just because you don't come out and say, hey, Nazis are good,
Oh, you
does
said
not
I'm a
mean that
Nazi
you have
sympathizer. When?
implications for the videos that you've made,
When?
right?
When?
When you were talking about the amount of Jews that were killed in the Holocaust.
Was Nazi sympathizing? I was debunking them. You fucking. Are you this fucking stupid? Did you watch
No,
my
I'm
video?
not. No,
You
I'm
are
not.
so
I have
fucking
something
stupid.
called critical
Okay, the
thinking.
Nazis are like, oh, no Jews died in the Holocaust. I'm like, no, that's wrong. Let me explain to you why using mainstream
It was a
sources.
specific other thing
You,
where
wow,
you
look
were
at you
debating,
sympathizing with the Nazis.
where you were
What?
debating. You
This is
also have a lot
crazy.
of, you also have a lot of Nazis were socialist shit
Yes,
because they weren't, though,
they were.
right? According to historical fact, they actually abhorred
According to
socialists.
historical fact. Which historical fact? Could you cite a history book? No, you can't.
Just
You've
because I
never read
can't pull a
book on the
history
subject.
book doesn't mean a quick
I can
Google
cite a
search can't
bunch.
show you they
Hitler's True
fucking
Believers
hated.
by Robert Delately. Hitler's National Socialism by Reiner Ziedelman. Hitler's Beneficiaries by Gotts Alley. I could go on. You see,
Ben, again,
that's the
just
difference between us
because
two. You're such a pseudo-intellectual.
a quick Google search would
Again,
show you.
when did I sympathize with Nazis? So go on with the Holocaust thing, right? So debunking
Jet, are you-
Holocaust deniers, that's sympathizing with Nazis.
Jet, are you on this?
Go ahead. So you don't have an example?
No, I'd like to stay on topic.
Well, you said I'm a Nazi sympathizer.
I never said you were. I said if a lot of people are calling you that, maybe you could be.
Oh no,
Right?
all of the people who hate you are calling you mean names. When did I sympathize with Nazis?
Ben, again,
Why did
I'd
you bring
like
up
to
the
stay
Holocaust
on
thing?
topic
Why did you bring up the Holocaust thing?
because you
You're
asked for an
angry?
example. There was
How
an
is that an
example of you
example?
under exaggerating the amount of people killed in the Holocaust.
Under exaggerating. When did I do that? Could you give me an example?
Again, Ben, I know what you're doing, right?
You know I'm trying to expose you for being a liar. Yeah.
No,
Yeah, absolutely.
I'm not a liar.
When did I underplay the number?
Because
ahead, tell
I
me.
just use
Cite
facts.
the video. When was the video posted? Let's play it. Let's play it on stream.
Ben, why would I know when your video was posted?
Because you're referencing the video. Let's play it on stream. Let's see. Let's see if I downplayed
It has
the
no
Holocaust.
basis in our argument. You asked a question, I gave you
just
an
called
answer.
me a Holocaust denier, basically, or downplaying.
You
the
asked a
Holocaust. Where's the
question,
evidence?
I gave you an answer.
Where's the evidence? How did I downplay it?
Again, you asked a question, I gave you an answer.
And I'm asking you to elaborate on your answer. You not know how
I don't
human
need to
conversation
because
works?
it doesn't pertain to the debate that we're having.
I mean, you're already getting mogged in that. Like, I think you'd actually have a better chance in this, even though like this is impossible. But that's just how bad you were losing.
It's really not impossible.
Okay, prove it
Because
then.
you've yet to explain to me why your side overrules all
I'm not
of these
overruling
American
anything. I'm pointing out the
associations of
evidence
medical
doesn't exist.
research.
I'm pointing out the evidence doesn't exist.
Okay, then explain to me, right? If you're gonna you're almost there, right? You've almost got me, right? You've almost got me. You've almost got me.
Oh no, I
on
already
your side,
got you.
right?
Like you're it's over.
No.
It's
You've
over.
you've almost got me on your side, right? This could be a huge win, right? Why? Why would they all lie? Why would they all of these different medical associations, scientists, doctors, all of the majority of why would they all lie?
Well, it's not necessarily that they're all lying. Like I could imagine some of them could be lying. In that case, there's many different motivations for lying. There's, money. This is actually an industry where you make a lot of money from all of these transitioning surgeries and
Again,
treatments
because
and so on.
insurance,
So
things like that haven't caught up, but yes.
So that's one example. Also, example of getting recognition for introducing like new studies on a specific topic.
They're not
like Jack
new.
Turbin
It's been
won
decades
some
and
awards.
decades of these things happening, but continue.
Yeah. And then also
these
like,
are all
if we're
again,
talking
these
about-
are all what ifs. I
if we're
want your
talking-
actual reasoning. Why? Like what's the actual facts?
If
Remember,
we're
facts.
talking
Why?
about like professors, psychologists, doctors.
No, we're talking about
overall,
these
they are
medical
really bad.
associations.
Overall, they are really bad with statistics. They are simply very bad. And we have overwhelming evidence to show this. So, for example, Liu et al. Study, it's 2019, more than 85% of students and professors from the following fields endorsed at least one misinterpretation of p-values and or confidence intervals: science, engineering, medicine, economics, management, psychology, and math and statistics. Zuckerman, 1993, 551 psychologists. When given a quiz concerning common statistical issues dealt with in psychological research, psychologists on average answered 55% of the questions correctly. I can go on. I have 1, 2, 3, 4, 5, 6, 7 papers on this, going over epidemiologists, psychologists, statisticians who consistently fail at reading these studies and at like explaining statistical issues. And that's empirical, that's solid empirical evidence. That shows you, like, even if people aren't lying, they could just genuinely be misunderstanding.
But again, explain to me why these organizations, all of these organizations facing all of this backlash right now, would continue pushing for gender affirming care.
Well, again, they could be misunderstanding the data because, again, none of the data supports their conclusions.
So you think
as I
across
pointed out,
the
none
board,
of them cited
hold
data
on,
that supported
hold on. So you
Not
think
one.
across the board, all of these medical associations are all misinterpreting this data?
Yeah,
Do you understand
it.
how
I proved it.
incredibly
Again,
insane that
they
is?
cited studies that didn't even say what they
Again,
claimed.
you citing 25, 26 studies does not negate the thousands,
Their
tens of
studies.
thousands, hundreds of
Their
thousands that
studies.
have been done over the
Hundreds
decades
of thousands
redefining
of
this.
studies? Hundreds? Are you fucking stupid? You think there's
It's
been
been
hundreds of
70, 80 years in America at least.
You think there's hundreds of thousands of studies on this? Where do you get?
I think actually yes.
That was actually
I think you could
stupid.
actually
No, there's actually
yes.
like a few dozen.
Excuse me?
There's like a few dozen on this subject for minors specifically.
On the subject of gender affirming care for minors.
Mm-hmm. There's a few dozen.
Well, that's just a lie.
No, it's not.
Yes, it is. Like that's a bald-faced lie.
Prove me wrong. This is so fucking funny. Hundreds of thousands. No, see, like when I was watching your stream and you said that, the hundreds of thousands of things, I was like, there's no way he's dumb enough to say that in the debate, right? Thanks for proving me wrong. That's the first thing you
When we were talking a moment ago, I wasn't specifically talking about kids, but if you want to talk about kids and say that there's a few dozen, we can.
No, even adults, like there's definitely not hundreds of thousands. There might be a couple hundred peer-reviewed papers on the topic. Specifically the topic of like the efficacy of transitioning, medically transitioning. There's going to be a lot more on the transgender topic in general because it's a very broad topic, but
that's what I just said. Are we changing it now?
That's definitely not what you said.
That's exactly what I said.
So your claim is there's thousands of studies on the topic of transgenderism?
No, not, first of all, transgenderism is not a term, it's gender dysphoria, but yes, on gender identity, on things like this, on what it takes to help these people. Yes, I absolutely do.
No, but that's not what all of them are. They're not all on like what it takes. Some of them are on like methodological issues, like the one you plagiarized in your opening statement, for example. That one wasn't about like helping them. It was about what type of studies we should do.
Again, that would still pertain to the healthcare of these individuals, correct?
I mean, to some extent, but like,
no, not
that's
to some
your
extent.
Evidence?
It would.
Your evidence for the overwhelming data is like, oh, there's some studies on like the methodology of randomized control trials.
Again, these are things that need to happen in medicine in order for medicine to continue. We need to know how to view these things. We need to know what lenses to view these things.
I'm aware of that, but like,
so then yes, it would be pertaining to gender affirming care. I don't understand where the disconnect is.
I'm not saying it's not pertaining. I'm saying it's not pertaining
no, you just
to
did.
the topic about efficacy.
No, you just said it does not pertain to gender affirming care. That's what you just said, dude.
That's literally not what I said. This is absurd.
Not absurd.
It is. Could we do like an IQ test on stream? Like we can both take like IQ tests at the same time. That would be really fun.
No.
Okay, I didn't think so.
I don't know why. To what end?
No, I just think it would be really funny. All right. Yeah. Well, okay,
Again,
let's
are we going to
rewind.
keep arguing the point and bringing up our reasons as to
No,
why?
let's rewind. So let's
Or
go to the let's go back to you citing all this thousands of studies. All right. So the last one you studied, again, tiny sample size. It was a convenient sample. So like right off the bat, we have serious issues with bias. We have serious issues with not having the statistical power because of the small sample size. But not only that, but they used an implicit association test for this study, which are notoriously unreliable. I have two sources on this about how unreliable these are. One is Ulrich Shimak from the Department of Psychology at the University of Toronto. He has a published paper on this. Quote, I find no support for the claim that IATs, which is, of course, implicit association tests, which is what's used in your study, have practically significant incremental predictive validity. IATs are widely used without psychometric evidence of construct or predictive validity. And this paper has the same issues. I have two papers about how these types of tests are bad. And not only that, but the paper you cited literally has nothing to do with the efficacy of gender affirming medicine. So I don't even know why you brought
no,
it up.
you brought up no. The reason I brought it up was because you brought up the fact that these kids don't believe that they're having a psychological issue. They don't believe that they express as this gender.
I did not say that at all.
Ben, yes, you did.
No, I didn't. I said that these kids can't understand the implications of bleeding to death through their vaginas or having
Nope.
brain maturation issues
We then
or their
moved
bone
on.
density getting worse.
We then moved on after some more outbursts to the topic of kids not actually feeling this way.
I didn't. I never said that. I acknowledge that gender dysphoria exists, and kids, especially today, especially after they're told, you know, about these different treatments, they feel like maybe they want to change their gender, medically, socially, and they think that'll help them. But
so to argue that point, right? I would ask you a question. Why would, if kids are following trends, if kids are doing what just what's cool, or kids are doing these things, right? I've already explained to you how long it takes to just get diagnosed with gender dysphoria. Not even to take puberty blockers to do these things.
I said they're going with what they think will make them
First
better.
of all, you have mentioned that they're following trends.
Yeah, actually, my quote in the opening statement was a direct quote from you. I quoted from your stream where you said that kids are flippant. That was a direct quote from you. I guess you didn't remember. So you claimed kids are follow trends and are flippant. You also said in your stream that the things that these kids are told by the medical professionals will, quote, blow your effing mind. Blow your effing, blow your effing brain off or head off, something like that. Blow your effing head off. That's what you said.
Absolutely.
Like, if I can't even like deal with the amount of stuff that these medical doctors are going to throw at me, how do you expect like a 13-year-old to do that?
That's exactly why it actually supports my side. If a kid is thrown all of these things and still believes wholeheartedly that it's the right decision for them.
That's a crazy like implication from this. Like that's just absurd.
It's not
such a weird way to
it's not though. Kids
I know this is super hard for the kids to understand. Like we're throwing so much out at them. But
I never said hard
with it. Like it must mean because they understand.
I never said hard. I never said hard for them to understand. I said difficult to take in.
If it will blow your head off.
I never said hard to understand. I said difficult. I meant difficult to take in. That's what that meant. Taking things out of context without the full context is insane, honestly. But what we were talking about was, since you were watching my stream, was, you could probably recall, the fact that kids being told all of these things that could possibly happen, these side effects, which are the majority of reversible, and still saying, this is what's best for me. Their parents still saying, this is what's best for us. Completely speaks to the validity of these things.
Based on bad evidence.
Again, if it's blowing their brains off, and a second ago you just said, wouldn't that mean that kids would, now you're flipping to it just being bad evidence?
No, I'm pointing out it's based on bad evidence. I'm not flipping. I still agree. It's very difficult for kids to comprehend if they're even.
I never said, do not twist my words. Do not twist my words. I did not say difficult to comprehend,
No, I'm saying it's difficult for them to comprehend. That's what I said in my opening statement.
but it's not, right?
It is.
They can't give informed consent without them comprehending what's going on. That's
How
how
do you
informed consent
quantify that?
works.
How do you quantify that?
Well, usually they continuously meet with a psychiatrist, the one who had been repeatedly diagnosing them with gender dysphoria for years at this point.
Not really. I mean, for example, like in the case of the St. Louis clinic, they only required the kids to see a therapist twice, and they actually gave the therapist like forms that were already pre-filled out where they just filled in the kid's name and then said, "Oh, you know, they get to go through with this." And then
Again,
they
I would
sign their
love
name.
you. I would love you to actually provide me a source on that, because that sounds
Yeah, sure.
incredibly insane.
There,
Because I
Jamie
actually
Reed,
have a friend who works in this field, and across the
Okay.
board, that is false.
not across the board.
If
So
they were doing that,
Jamie
then
Reed was a whistleblower from St. Louis. She's a
this is the
leftist.
okay.
She's a leftist. She's married to a
Mhm.
transgender person. She
Mhm.
agrees with you on
Which
99% of things, except for transitioning kids, and she disagrees with me on nearly
or
everything. And
except
she,
for this one specific place, right? That faced repercussions for what they did, right?
so you do acknowledge that this happened.
I never said it didn't happen.
No, that's what I'm asking you. You do
Citing
acknowledge
one
that this happened.
instance, citing one instance that happened is not
Well, it's not
citing that
one
the
instance.
whole thing is
It
bad.
happened to hundreds of children.
Again, citing one place in one state in one city.
Well, we know
Of
it's
the
happening
US.
at least once, so that's pretty. That's that's a bad thing, right?
Yeah, that's a bad thing, and that one thing should be shut down. It is not a basis to shut down gender affirming care for all children across the
Well,
US
that's not the
because of it.
basis. That's absolutely not the basis. The basis is that we don't have the evidence to support it. Again, like, and you still haven't presented it at
No,
all.
we do. Again,
Okay,
just
present it.
because
Give me the evidence. I keep asking you this, and like you give me irrelevant evidence. You give me studies that disagree with you.
this is the form that you need to fill out to start HRT.
There it is. Like you can't give me the evidence. You said there's
No, this is the
thousands of
evidence.
studies.
No,
Show
this
me.
is the evidence.
The evidence.
You
is
wanted
a
to
form?
know. You wanted to know how difficult it is for
No,
these
I didn't.
kids
No,
to
I
begin.
didn't. I never said that.
You
I
just said it was.
asked
Hold
you
on.
to
The
show me the
implications.
evidence that it
Hold
helps
on.
the kid.
The implications of what you said were that these things are easy for kids to slip through. Your words exactly. Not really. I mean, there was a place in wherever the fuck, bumfuck nowhere that did these studies that
St.
blah, blah.
Louis is bumfuck nowhere.
Yeah, I mean, kinda. Missouri, come on.
One of a clinic that treated thousands and thousands of kids, like had some of the most
Oh, my
kids out of
bad.
any
I didn't.
clinic
Hold
in the
on. Hold
country.
on. I will own that. I did not mean to make it seem like that clinic was insignificant in terms of where it is in the country or anything like that. I was meaning the state bumfuck nowhere, not the place. I apologize for that. Truly.
But again, like you're this is not my argument. My argument is the evidence is not there, and I've repeatedly asked you to present the evidence. And when you jump onto another topic, then you're just making things go all over the place. Like, where is the evidence? The last
Evidence
study
of
you
what?
said didn't
Evidence
work,
of what exactly?
that this helps children.
That's not the
last study
topic
you
we were
cited
on.
wasn't
The
even
topic.
this
Hold
topic.
on. That's not the topic we were on. What was the topic we were on?
All right, dude. Like, if you can't, okay. Do you concede that you don't have the evidence that this helps children?
I mean, I have evidence that it would help children.
Okay,
You
show
don't
me.
seem to like that evidence,
Show me.
but I do have evidence.
Tell me. This is literally the debate topic, and you keep refusing to actually engage with it.
Okay. Association between recalled exposure to gender identity conversion efforts with psychological distress and suicide attempts among transgender youths that eventually became adults. Just, I need to add that caveat. So, in this cross-sectional study, a survey was distributed through community-based outreach to transgender adults residing in the United States, with representation from all 50 states, District of Columbia, American Samoa, Guam, Puerto Rico, and all the U.S. military bases overseas. Data collection was conducted from August 19th to September 21st of 2015. An analysis was performed from June 2018 to January 2019. Of the over 27,000 respondents, they only focused on the 3,869 who had reported exposure to conversion efforts to combat gender identity disorder. Then they compared those who had lifetime exposure to conversion efforts, those who had experienced it under the age of 10, and those who had never experienced conversion efforts. After conducting the findings, they showed that across the board, those exposed to conversion efforts under the age of 10 showed worse mental health outcomes for every metric taken. These metrics were severe psychological distress in previous month, suicidal ideation in previous month, suicidal ideation plan in previous year, suicide attempt in previous year, suicide attempt requiring hospitalization in previous month, lifetime suicidal ideation, lifetime suicide attempts, binge drinking in previous months, lifetime cigarette use, lifetime illicit drug use, which we can which we all know is a symptom of some sort of declining mental health. Across the board, those exposed to conversion efforts before the age of 10 led in every category in percentage of patients with outcomes.
Okay. So yeah, Turbin's, this is one of Jack Turbin's studies. He has a couple of them, and they use the USTS survey, which is a survey of transgender individuals and other gender nonconforming or so on and so forth people.
Yes.
So there's a few issues with this. So right off the bat, it's convenience sampling, which we've already established. That's not good. So, well, actually, maybe we didn't. We talked about that a little bit. But so what convenience sampling is, it's kind of in the name. You're taking a sample out of convenience. So in the case of Littman, which you criticized for the convenience sampling, what she did was she went on websites where she knew she would find parents who were skeptical of their children transitioning, and then gathered those parents for the study. Because that was very simple. She was able to contact those websites and say, this is what I'm doing. And they're like, oh, we agree with you. We'll let you do that. Right. That's a convenience sample. This is a convenience sample. She went through pro transgender sites and this RP and this survey overall. So it's not representative because it's convenience sampling.
It's representative of specifically transgender youths. Yes, it is.
No, it's not. Absolutely.
It is absolutely.
You know why I know it's not representative? Because Jack Turbin says it in the study.
Yes. First of all, it's representative of the topic that we are talking about. Yes, it is.
Do you know what a representative sample is?
One that represents the results that you're trying to achieve?
No, not even close. So you have samples, right? The people who are actually participating in the study. That's a sample. A representative sample is something that's representative of the general population that you're studying. So in this case, it would be transgender youths or people who transitioned as youths. That's a representative sample, right? So if you take a compliance sample, let's say I want to know how many people in my town watch TV on a daily basis. A convenient sample might be me just asking the people in my house because, oh, look, they're right there. Let me just ask them. 5 people. Now we take 5 people. 100% of the people in my town watch TV. That's convenient sampling. Of course, this is much more complex. I'm not saying what Jack Turbin did is as bad as that, but that's convenient sampling, right? And it's what Littman did. So that does not give us a representative sample. Also, it's not randomized. So that's another problem with like giving us a representative sample. But most of all, this is a very important point, especially with these studies. So when you're measuring suicidality and mental health outcomes, it's very, very bad practice to do self-reporting, because a lot of people, they have difficulty answering questions about suicidality. So there's been researchers who have been studying this and showing like, okay, if we ask people one question and then like the next day ask them another question, we want to see how much the results change. And what they find is like the results do change a lot. So sometimes it's a difference of like 50%. Like there's a 50% variation in the results. I have a couple of studies on this from the last couple of decades. So what you have to do is you have to have it reported through a clinic, a clinician, somebody actually there like administering this test, not just self-reporting through a survey. And you have to have them ask the right questions and maybe even ask multiple questions concerning this, because if you don't, like, you're just not going to get a good sample or you're not going to get good answers. And this can lead to like very bad results. This is especially serious when we're studying topics of suicidality, because if we get things wrong, there's all sorts of studies looking at antidepressants and all sorts of things. So this is something very important that the general science has not grasped onto yet, despite all the evidence, because people just don't know about it. So like if this doesn't control for these issues and just has self-reporting, like we absolutely can't depend on it, because we have no clue. Like we don't know anything about these people. This isn't a clinical study. It's just an online survey.
Fair. I'll concede it.
And despite what you think, I do genuinely care about people. I know you don't think that. I'm not up here because I want to own the libs like you said I was. I don't want children to kill themselves. I don't want transgender children to kill themselves. I know that's what you think, but
Absolutely.
you can see I actually did the research because I actually care about the issue. That's why I talk about it, because I care about it.
I
It's
still
not a
don't think you
culture
care
war
about
thing.
the issue without an unbiased lens. You will never.
You
I
can think that if
genuinely
you want.
don't think you will ever.
I looked at the
You'll never
evidence.
convince me of that. However, I will concede. Shouldn't have brought up this study.
All right, fair enough. Do you have any more you want to talk about?
Probably.
We could go over the Tordoff study again. I can explain in more detail some of.
No, because the people who made that study have already come out and debunked what you were saying about it.
Could you give me an example?
Yeah, hold on. Well, I mean, not
Like
here.
Jesse Singal is a journalist who largely writes about this topic, and he looks into like malpractice in psychology. He wrote a book about it, and he emailed one of Diane Toroff's people, one of her people who helped her in the study, and they verified that they didn't see any improvement for the group that got onto
I
care.
never said improvement. I never said improvement.
Right, but that's often how the study is presented.
That is not how I presented it.
Okay, well that's fine. All right, well you that's fair, right? You said that compared to the untreated group, there was a big difference,
Yes.
and that's true. But what
Yes.
we have to the big issue here is something called attrition bias. So what attrition bias is like if you have a sample, the participants in the study, and a bunch of them leave, which this is very common, where at least some people will leave over the course. This was a 12-month study. Some people will leave over the course of a study, and there might be we might be able to deduce reasons why they're leaving. So, for example, this is a clinical study. These are parents who are supportive of their kids, of
Yeah.
course, because they're bringing them to a clinic. So if the kids are leaving before they get on gender affirming treatment, we could think maybe they're leaving because their mental health improved. Maybe they're leaving because they desisted. We don't really know, but we do know that a lot of them left. 80% of the untreated group left. So like, it's really tough to like make any conclusions off of that, because the
But the
final
conclusions are still there nonetheless.
they are there, right? But what we're talking about evidence, like actual evidence. We're not talking about, like, oh, after 80% of the people left, then this is our, it's there's no like statistical power to it. There's 7 people left, right? So they started off with 93 and then there's 7 at the end. And like I think the kind of a reasonable thing to do would be to compare the 12-month treated group with the baseline untreated group, because that's like um a more fair comparison, because we're actually comparing like groups of people, and there's no statistically significant difference there, as Tordoff and others pointed out. So it's like, can we really deduce that this improved? Not only that, but like, they put them through psychotherapy, which that's what I support for these kids. They should go through psychotherapy, because there's often many other issues. A large number of these kids have autism, and some of them have multiple personality disorder and all sorts of different issues. They're very, very
Yes,
common.
however, denying other care because of other things that exist is not how medical procedures are done.
Well, obviously, right? But I'm saying like
Right? Like I have
psychotherapy is a better option
ADHD
because of
and
that.
depression. I'm diagnosed for both. I'm treated for both.
Right. Like, yeah, that's not what I'm implying. I'm saying like psychotherapy helps account for these other issues. Right. I mean, at the
Right.
very least, if you're going to treat kids medically, you should be putting them through psychotherapy, which is what Tordoff did. or whoever administered the actual procedures did.
I don't think it
But
was Tordoff.
yeah, I mean, she was like a PhD student. She was just kind of keeping track of things. But yeah, like the big issue here is attrition bias. Like if we were able to not have that issue, which I think she actually says something about this. There were a small number of youths who did not complete on each survey, four at baseline, 3 months, one at 6 and 12 months, and then a large number of them actually got on the treatment. So it's like, why did those people leave? And then, like, is this last group really representative of the 7 people really representative? I don't think so. And I'm not the only one who doesn't think so. I can cite peer-reviewed papers where the people who are experts in this area agree that this isn't a good conclusion to make.
Fair. Fair.
And I'm glad we're having a slower conversation right now. Like I said, I wasn't planning on like doing all the dunking shit, but like I kind of, when you interrupted me when I was answering
It's
the question,
fair.
I was like,
Debating is not my strong suit, clearly.
that's fine. Like, I mean, I had props to you for doing it.
I still have questions for you.
Sure.
These are more overall pertaining just pertaining to the topic, not really what can you provide type things. What do you think the reason for these kids transitioning are?
Yeah, I mean, I kind of answered that a little while ago. I know you were kind of asking a different question, but it's kind of related. I
Mhm.
think so. They have gender dysphoria, obviously. At the very least, they think they have gender dysphoria at the very least, but they have gender dysphoria. Um, they're questioning their, am I a boy? Am I a girl? Am I neither? For whatever reason, it could be because they had some sort of experience. They met somebody who said, well, you don't have to be a boy or a girl. They realized maybe they prefer things that boys or girls their age prefer or don't prefer. Maybe they have just underlying issues. Maybe there are biological issues, and in endocrinology, neurobiology, there could be things that influence this. Oftentimes homosexuality will actually influence this, and I think there's a fair amount of evidence that some people are homosexual from birth, right? So that they're experiencing, same-sex attraction. And actually, like, if you get into like the brain studies, which you didn't bring up, but I had some stuff on the brain studies. If you get into the brain studies, what you notice is that a lot of the transgender individuals who have brains that are more similar to the opposite sex that they were born as, they're typically homosexual, right? So they're gay and they're transgender. So that's something, right? And then there's also
I
just
think when we get
other.
into topics like that, it's more not as based in fact as things specifically homosexuality, not as based in
What do you mean specific? You mean like the
what we
brain stuff?
believe. Yes.
I mean, I could like
I know there are.
there's not a we don't have good evidence on the trans brain stuff, which was going to be my main point if it came up, because they're typically these types of studies typically have very low replication, and they have very low sample sizes. So it could be the case that this isn't true, but like taking the existing literature that's usually used to say, this is why a person's transgender, it's because they have a brain that is more similar to somebody else that they weren't born as. Um, that's not really true. But like, if we take that existing stuff, we find, if you control for their sexual orientation, then those results go away, for example. But like, sure, that's still like a small amount of evidence. Like, I'm just kind of theorizing here, admittedly so, right? Like,
Right.
we don't have a real like solid understanding of why like gender dysphoria even comes up. That's why like people like Littman wrote her rapid onset paper, because she's like, this,
which
we don't
admittedly
even
flawed.
understand. Yeah, absolutely. She's like, we don't understand this, like what's even happening, because like, you know, there has been a huge surge, of course, in recent years, especially after 2013, 2014, in younger people identifying as transgender. Some people it's said it's because of a
I
shift in the
think
culture, and maybe they
I
feel
think
safer
that was
doing it.
more, wasn't that more specifically aimed at girls experiencing gender dysphoria
Yeah,
instead of rather than boys?
yeah, it's both. There's a surge in both, but there's especially a large surge in girls, and that's like one thing people
Yeah,
know.
and
They're like,
prior
why
to
is it
2011,
a large
yeah,
surge in
well,
girls?
I mean, I know prior to 2011 there is no, or 2012 there's no research on transgender girls, and there could be like society implications for that and reasons as to why. But
And but
I
just
think
to
that's
clarify, when we're saying girls here, we're talking about born female.
cis, yeah, biologically sex
That's a
or
huge surge in
biologically female.
a huge surge
Born,
in
yeah,
born
born,
females
yeah,
identifying as trans.
sex assigned at birth. Um, I think as years have gone on, there's been a lot more research done in the topic of transgender or of AFAB kids. I still think rapid onset gender dysphoria is an incredibly flawed study. But I do agree more research needs to be done on specifically girls. I think enough has been done on boys to establish at least some sort of baseline, at least for the medical communities to go by. And until it's seen as actively harming these kids rather than helping, there is no reason to take it away, as there are already so many barriers to entry when it comes to being diagnosed, being put on these things, being able to get a surgery at some point in time. You know what I mean?
Right. Yeah. I mean, so like I say, I still think the evidence overall is weak. So what I say is let's do a lot of the things that the other countries have done. Let's stop making this stuff just available to kids. Let's slow down. Let's look into things like rapid onset gender dysphoria. Like if people were devoting these resources to look into things like that, to look into, you know, like the prevalence of autism and other things in these kids, and look more into like why this happens, look in more into psychotherapy. There should be more studies on just treating kids with psychotherapy. That's what a lot of people in the US and other countries are advocating for, a lot of academics.
I think enough of that
That's
was
what we should do.
done prior to the beginning of gender, like the foundations of gender affirming care, as they saw it as more of a disorder rather than something that could be, or a disorder that couldn't be treated with social implications, things or social transitionings, things like that, and saw it more as a mental disorder that needed to be cured right now with some sort of psychotherapy. Do you know what I mean?
Yeah,
I
I mean
think more,
it's true that like it's not necessarily a disorder. It's probably more so a symptom of other things. Like again, but
it
again, like
is a symptom.
that's that's theories about what it's a symptom of. Like again, like the commonly explained thing from left-wing people that I hear is the brain thing, but that just like doesn't really hold up, so we can't go that direction. But that's why, you know, things like the rapid onset gender dysphoria and other various theories have come up. But it's like, yeah, I mean, that's the stuff we need to study, right? And like I said in the beginning, the burden of proof for implementing these procedures should be on the people who want to implement them. And like you said you disagree, but that's presupposing that the burden of proof
It's
is already met, right? Which
it's
I don't
not,
think it
well,
is.
I can't presuppose it because it's already happening, right? And the medical community typically does not allow these things to begin to happen and continue to happen for decades and continue to be redefined and reworked and done those ways without banning it prior to the legislation that's been pushed. I mean, over 500 this year in terms of transgender health, you know?
Yeah, I mean, But typically, like when this legislation is being passed, they have people come up and give their arguments for and against. And in the case of for, you have expert witnesses. These documents are available, and I could send you some of them if you want. I have like the expert witness documents where they even talk about some of the studies that you're citing here and why they don't agree with them, and why the bill should. I think that it's kind of underrated. Like people really should read. Like I'm really into court dramas and stuff like that, and I fucking love Saul Goodman.
Well, I had fun.
Um,
I had fun reading the Oklahoma bill court
yeah, like
document,
that, not
but
just like the bills, but like read, the people's different arguments. Because they have like expert witnesses come in or watch the videos if they're available, and like seeing both
I
sides. So
personally,
you
I
see like the
personally
contradicting.
feel that sorry for cutting out, but that there's enough evidence to support the fact that these bills are being introduced in bad faith by people who not only don't believe that kids should be able to transition, but adults as well. They don't believe in it as a real thing. And I think based on that basis alone, these bills are flimsy at best in terms of the way that they're introduced.
I mean, I would say maybe some of them are. Some of them I would disagree with, like the ones that include adults. I think after 18, you have full autonomy over yourself, and we can, according to research, we can say that you can make a fairly rational decision on average, at least. So, like adults, I disagree with. I don't agree with the notion that there's multiple sexes. I don't agree with the notion that transgenderism is true or whatever. Like I agree that gender dysphoria is a thing, right? So when you like earlier you said it's not transgenderism, it's gender dysphoria. When I say transgenderism, it's the idea that it's like legitimate to change from one sex to another, right? Like that's an actual
Well,
thing that's
nobody's
happening.
changing sexes. It's just changing gender. It's changing gender expression, changing the way, making your outside appearance, making your outside expression the way that you feel on the inside. I don't see any damage in that, even if, right? So
Well,
my
let's
my
go with
my
that. Like here, let me clarify just real quick a little
good.
bit more. So let's go with that. All right, let's grant like changing things on that side. But then it's like, well, now I'm a woman, right? I don't agree that someone's now a woman if they were a man before. I don't agree with that. I don't think that's true. Like we base what a woman is in sex, right? So I don't think that people should like
I don't think
get
that's
angry
true
at me or
necessarily.
whatever.
I don't think that's true at all, actually. I think do you mean in sex as in biology or in sex as in the ability to have such?
Biology. Yeah. So
Okay.
like the origin, like sex is
No, I get it.
understood as it's this is a
I just
misconception.
wanted to make sure that it wasn't turning into a
Right.
completely
No,
different
no.
thing.
Yeah, like there's a
Um,
misconception that like it's based in chromosomes, and often a lot of like right wingers will do the chromosome thing, but it doesn't really hold up. But like really, because like there's animals that don't have chromosomes, right? Like an alligator. Alligator's sex is not determined by their chromosomes, but a human being's is. So it's really like the gametes, right? We have two gametes. Gametes are binary, large gamete and a small gamete, and that's like how sex evolved. That's what sex is. It's represented by the two gametes.
right. But when we're talking about gender, we aren't talking about sex. We're talking about the social aspect of gender, right? Two completely different things. Gender is more of a social construct, sex a biological one. Nobody is claiming that people can get gender affirming care and then become a different sex.
Right. Yeah. I'm saying more so like some of the implications, like again, like the woman thing, like Matt Walsh kind of, I'm not a huge Matt Walsh fan. Honestly, I think he does a sucky job at this topic because he
I don't know
doesn't
if
do good
anybody is.
research. He doesn't do good research. I've tried to talk. I knew I was friends with one of his producers. I'm like, you need to tell Matt Walsh like he needs to like talk to me or something. Let him give him some good research because he like completely butchered. But I think that the whole like what is a woman thing is a very like important topic because like yeah there are a lot of implications there. The kind of the reason it was brought up was because like the left is often characterized as being like the feminist side and stuff like that. So, we're out
Mm-hmm.
to help women. And then it's like, well, what even is a woman? How are you helping? I think it's a very interesting thing to bring up. And that's more so what I'm talking about. I'm not talking about like whether it's legitimate for someone to express themselves in a different way. I'm talking about whether it's
Mhm.
legitimate for someone to like label themselves in a with a term that we already recognize to not include them.
What I still don't fully understand is why that matters to anybody. My reasoning being, if from child to adulthood they have gone through these different paths, whether it be puberty blockers, hormone therapy, surgeries, eventually to become a woman, right? They are then accepting the responsibility of everything that comes with being a woman in today's society.
By the way, we're going like way over time, so let's do like 5 more minutes maybe,
All right,
because I have stuff to do. So.
go ahead.
But yeah, yeah. There's not any like deep problems with it per se. Like it's not like a dire issue, but I like the truth, right? I don't think it is the truth. I don't think it is the truth to claim like Caitlyn Jenner is a woman, right? I don't think that's the truth, and I don't want to state things that are false. And that's more so it, right? Like it's not a deep thing. I'm not gonna. I don't have any hatred towards transgender people. Like I know some. I have a bunch of followers who are transgender. Actually, some of them message me all the time. Like I have no hatred for transgender people. I don't think there's anything like vile there. I don't think they're like inherently disgusting or anything like that. um yeah, it's more so like I think we should recognize the truth. Like there's a metaphysical reality, and if we're just going against that just to like appease someone, make them happy, then it's like I don't think that's what we should do, because like the implications of that are just telling far more lies.
And I would counter, the way society's further is by embracing new ideas, new things that, I mean, gender on a spectrum is or gender as an expression is not a new idea by any means, but furthering how we see the world is how society moves forward. If we are continuously holding society back from moving forward, then there is no then there is no progress being made, right? And to the point of, I like telling the truth. I like this is their truth, right? And it has no bearing on someone else's life, not yours, not mine, not Joe on the street. It only has bearing on their life, on their parents' lives, on the people within their own lives, but majority, this singular person. So the harm in not, or the harm in acknowledging these people and just being cordial with them and accepting that this is how they live their life is, I think, a much better society to live in than denying people the right to live the happiest lives they can.
Okay, I mean, fair enough. That's just something we're not really gonna agree on.
Yeah.
But that's okay. Like I think we should do closing, because like I said, we're like 30 minutes over. um yeah, so I'll close. I'll let you finish off, so I'll close first. So I've pointed out, what I really want to see is I want to see good evidence that this actually helps children. I don't really think we've seen that. I don't think it exists, at least not yet. Maybe it will in the future. Maybe we don't know what's going to come out this year or next year, whatever. All right, we'll see. We'll see what the future holds. I'm willing to be flexible on this as good evidence comes out. But the overwhelming amount of evidence shows us that there are in fact harms, and we do have to be very concerned with these harms, because like when it comes to children, when it comes to an adult, if they want to go drink alcohol, if they want to go, even do like blatantly non-medical surgeries, right? Blatantly non-medical surgeries. I'm not saying this isn't a medical surgery, right? I'm just saying, they want to go get their butts pumped with plastic. Like, you do you, right? You're an adult, you're a grown person. That's stupid. You're a grown person though. And if they want to get transgender surgery, medically transition, you do you. You have the freedom to do that. I respect your freedom. But when it comes to kids, kids have guardians, and the role of a guardian is to sustain a child, sustain their health, their life, or to make them better off, not to make them worse off. So if there's a treatment where there's a good chance, where the evidence tells us, this might cause more harm than good, then we shouldn't have that, right? We do know that causes harm for sure. Again, like we don't know the extent because like it's very tough getting the data for that, but we do know like when we actually look at the effects of these things, they do appear, and they exist theoretically on a theoretical level as well, right? Like, theoretically, if you flood a kid with a bunch of hormones, then it can cause brain issues, but it's also empirically true. And I have all this empirical evidence. If anybody wants it at all, I'll give this to anybody. Okay. If Peyton wants it, he can message me on TikTok, wherever. If anybody else wants it, message me on Instagram or whatever. All right. I'll send it to anybody. The cardiovascular stuff, the brain maturity stuff, all of it. Okay. And yeah, that's it. That's it. I don't think that we have the evidence. We're supposed to improve kids' positions. The guardians are supposed to improve them, not make them more soft. So if the evidence suggests we're not improving their lives, then we shouldn't allow them to go through with these procedures.
And I believe the role of a guardian, as you've said, is to do what they believe is best for their child and what the child believes is best for themselves. And none of these things are happening without parental and child informed consent. So taking away the rights of parents to parent their children is counterintuitive to any sort of small government things that people, myself included, want from our country. I think telling parents that they don't know what's best for their kids, I think telling kids that they're too dumb to make the decisions for themselves or they don't understand the decisions they're making is, again, counterintuitive to giving them the happiest life possible and letting the parent lead their child down the happiest life possible. And again, according to the practices of all American medical associations and according to the majority of medical and scientific research that they use, gender affirming medical care for transgender youths is vital and the safest way to ensure these children diagnosed with gender dysphoria grow into adults and live a long, happy life. That's really my point.